Remember, it's subject to 3 weekly reviews, and we come up for one next week. And I think the most important thing that we learned from this press conference is if you were expecting us to move from phase 1 to phase 2, you can forget it. At very best, we'll be moving to phase 1A. It will look a lot like the shutdown we're in at the moment by the end of next week. There could be some tweaking of some of the controls that are out there, but not much. Mainly, there will be a plan of action of how you get to phase 2, but that could be pushed off till the next review at the end of May, or maybe even longer than that. But we could be seeing a bit more flesh May the 28th when we get to the next review. There will, though, be, I think, next week, some measures to try and build up confidence to get some people to go back to the workplace who the government never really expected not to go to the workplace. There were some businesses shut down, some people stopped working, and some people think that the estimate of that is something like 30% of the economy that the government has found has stopped, and they weren't expecting to do that. So they're going to try and nudge them back into the workplace. One of those confidence building measures, it looks like, will be advice to maybe wear face masks on transport sometimes, maybe in certain workplaces. This is how Boris Johnson's first press conference after his return from hospital went, and I think, not surprisingly, you can occasionally detect a little shortness of breath.
Boris Johnson returned to the Downing Street press conference, a father again and a recovered victim of the virus.
I want to thank the NHS for so much, including getting me back here and, I might add, for a much happier hospital visit yesterday.
In his absence, COVID killed some 26,000. But, he said, the daily death tolls should now decline.
I can confirm today that for the first time, we are past the peak of this disease. We're past the peak and we're on the downward slope. We've come through the peak, or rather, we've come under what could have been a vast peak, as though we've been going through some huge alpine tunnel. And we can now see the sunlight and the pasture ahead of us. And so it is vital that we do not now lose control and run slap into a second and even bigger mountain.
He challenged those who point to graph lines suggesting Britain has the worst record in Europe on lives lost to COVID-19. He rejected the claim he'd been too slow to move to shutdown.
It's a very, very demanding thing to ask a population to do, very tough. And so I think it was completely right to make our period of lockdown coincide as far as we possibly could with the peak of the epidemic.
We're through the first phase of this. There is a very long way to run for every country in the world on this. And I think let's not go charging in to who's won and who's lost at this point.
Earlier, the Prime Minister chaired his first cabinet meeting since returning to Downing Street. At the press conference, he suggested there could be advice to wear masks for some in the future as part of a government plan of action.
So I will be setting out a comprehensive plan next week to explain how we can get our economy moving, one, how we can get our children back to school, back into childcare, second, and third, how we can travel to work and how we can make life in the workplace safer.
The government's hoping some construction sites they never intended to shut down might reopen. Other businesses, like call centres too, helped by government advice on how to reconfigure workplaces to maintain social distance. But the wait for some sectors, like catering and hospitality, could be far too long. Zoe Ojonyo has run her own catering business for 10 years.
The first week of COVID, the whole summer went. Weddings, corporate bookings, all of our festivals. Our festivals are our biggest income earners. You know, I am having to seriously consider liquidation at this point because I am insolvent. It's 99% going to happen probably today. I have to make the decision.
Today?
Yeah. I mean, I've got the forms.
The Prime Minister acknowledged the frustrations of reaching government targets like 100,000 COVID-19 tests a day. NHS trusts said such targets amounted to a red herring and were no substitute for a proper strategy.
We understood as to why you initially set that 100,000 target as a means of galvanizing action, but it's not a strategy, it's a target. And what we absolutely now need is clarity on what are the next stages of the testing regime going to be, particularly because we've now reached a point where we are considering coming out of lockdown, and we absolutely need to ensure that in the testing regime, we test to avoid a second peak.
Next week could see those already allowed to work encouraged to do so. It's not expected to see a big change in the shutdown rules.
Gary Gibbon reporting. Well, I'm joined now by Sir John Bell, Regius Professor of Medicine at Oxford University, who is working on the development of a COVID-19 vaccine. Thank you very much for coming on the programme. First of all, your reaction, please, to what the Prime Minister had to say today, that we are past the peak, but we're in a very volatile state and we don't want that infection rate that is currently below 1 to go up again.
Yeah, so he's absolutely right. The data looks quite persuasive. I think all over the country we're past the peak. There's still some hot spots in the West Midlands and London, but it looks much better now than it did 2 weeks ago. But this is really it's the end of the beginning, as they say, rather than the beginning of the end, because we've got a long haul still to go. And this next phase is going to be extremely tricky, because if we are going to use track and trace methods to track people who, A, have the disease, test them, find out who they are, and then find all their contacts and get them all to lock down again, it's going to require thousands of people who are responsible for that track and trace process. And that's one of the crucial things, is to get that in place now.
As I said at the beginning of the programme, this is a war that is fought on so many different fronts. One of the fronts that you're involved in, of course, is the vaccine. I think you've said in the past that we won't get a mass vaccine by earliest the beginning of next year. Is that still the case?
That's possibly still the case. I think what's happened is that there is one vaccine that looks like it could beat those numbers and perhaps be available for the UK population in September. And that's the vaccine from my institution, developed by the Jenner Institute in Oxford, where I think it's possible we'll see efficacy data by the summer, in which case, if we're on our toes and get regulatory approval by August or September, it's possible we could vaccinate the population as soon as the end of September.
Ah, okay, so let's be optimistic then. What you're saying, just to reiterate, that we could, if we're lucky, if this one works, we could have a mass vaccine for all 60 plus million of us by September, October?
Yeah, that's what I'm saying. I mean, I think there's an interesting question about whether you vaccinate all 60 million people, but you certainly vaccinate all the vulnerable populations, which will be in the tens of millions. So that I think is possible, but I should just caveat that by saying this is still a vaccine in development. It's not a vaccine, it's a vaccine in development. And it takes on average about 8 years to develop a vaccine. And these characters in the university have managed to do it in about 18 weeks. So it is quite remarkable where we are now.
That is astonishing. Now, what about antibody tests? I think you've written about those as well recently. They've been quite problematic. Why is that?
Well, they have. So we moved quite early to try and evaluate the home testing kits that you would use for testing antibodies at home. And what we found was that they weren't either very sensitive or indeed very specific. So they really weren't much use in terms of giving you an indication about whether you had antibody levels or not. In fact, some of them, if you took all the positives, more than half the positives would have been false positives. So that's not very much use to anybody. So we've been back to look at how we might improve them. And there's a group now working to improve the handheld tests. And I've seen some data this week that it suggests that we might well get to a much better test in the fairly near future that everybody would be able to use. So early days yet, but we've definitely taken a move in the right direction. And to be clear, we lead the world in this field. We were the first to spot that handheld tests didn't work. Now everyone else, the Canadians, the Americans, even the WHO has agreed with that observation.
So we may lead the world on the science. Do we also lead the world, or are we in a good place when it comes to actually implementing this production?
Well, I think you should pay attention to the to the PCR testing setup, which again, I was involved in helping to set up. The 3 big lighthouse labs are absolutely remarkable in global terms. 100,000 tests a day, and if you want to bet me a bottle of wine, I'll bet they're going to get there today. But these were set up in 6 weeks by volunteers outside of the National Health Service as independent testing labs. I don't think anyone has ever done that before, and they are carrying by far the biggest percentage of that 100,000. In fact, I think about 70,000 of those tests are coming from the lighthouse labs. No one else in the world has done that. And in fact, the Australians were on the phone to me the other day saying, how did you do that? That's absolutely remarkable. So I know we got started slowly, but I can tell you things are moving pretty well in the UK now.
Now, the Prime Minister said today that if many of the things that we put in place had not been put in place, as many as 500,000 people might have died. Is that a realistic comparison as far as you're concerned?
Well, what we do know is without the lockdown, there would have been many, many more people who suffered. And the data, which I haven't seen the scientific report, but the data in the press today was that if people admitted to hospital, 36% of them die. So this is a really lethal disease. It's a pretty awful disease. And many people, particularly younger people, can get it and steam straight through it. But for elderly and vulnerable populations, this is a really nasty disorder. So I don't think 500,000 was an overestimate at all. I think if we had been allowed to stay out on the streets and spread this widely, that's where we would have ended up. And there's an important message, because we're now releasing probably 90 to 95% of the population are going back after the lockdown without antibodies, which basically means we are completely naive to the virus. And if we get it, we'll be in the same place as we would have been 2 months ago if we hadn't had the lockdown. So we got to be very careful about how we do this.
Message received. Sir John Bell, thank you very much indeed.
Yeah, thank you.
Now, if you need urgent medical care, seek help. That is the message from the government tonight, as concern grows over the fall in the numbers of people going into hospitals with conditions such as heart attacks, strokes and cancers. It's thought that many are staying away, fearful that they might contract the coronavirus. Our health and social care correspondent Victoria MacDonald has been to Walsall Manor Hospital to see how they are restructuring their wards to keep patients safe.
In all the planning and preparation for coronavirus, this isn't what they'd expected. That outside the COVID wards and the intensive care units, hospitals would be so quiet, even in the emergency departments. And it is worrying. There are only a handful of patients here today. Normally, they would have as many as 250.
Really sick patients who should be coming, who may be having heart attacks or strokes or suffering sepsis or some cancer-related complication. And they're the ones who aren't turning up. We've seen a reduction in those numbers.
In the non-COVID area of the emergency department, we met Rudo Chitaro, who was waiting to be assessed for spinal pain. Were you worried about coming in?
Yes, I was. I'm still very worried because of the situation and my health condition. You know, when you feel pain, and when you come to hospital, it's like a safe haven. But this situation is no longer like a safe haven. It's like you're just compromising yourself.
There is concern about the Black, Asian and ethnic minority communities and whether they are disproportionately affected by this virus. Trusts have now been advised to risk assess their BME staff. And here they lost Arima Nazreen. She worked on the acute medical unit and was one of the first nurses in the NHS to die.
So for patients who self-present, they'll walk into the main entrance. They'll be greeted by Anita, who's an advanced nurse practitioner from the Urgent Treatment Centre. She'll do some screening questionnaire and decide whether the patient is likely to have COVID and will therefore be put behind the barriered area on the right, as opposed to the non-COVID patient who'll be sat on the left side of the department. We'll be separating patients right at the point of entry into COVID and non-COVID patients and keeping them separate for the whole of the duration of their stay.
The separate emergency department COVID ward, set up of course because of the pandemic, but now likely to be here for the foreseeable future.
NHS England has now written to hospitals saying that they must prepare themselves for more patients coming in once the restrictions on lockdown are eased. But they are also saying at the same time that they must keep their spare capacity for COVID patients, just in case there are second or third waves.
The message is the same here in the antenatal unit to would-be mothers: don't stay away. In fact, they've taken to ringing up those who don't turn up to reassure them.
And when you do contact them, it's usually because they are concerned about coronavirus?
Most of the time, yes. Yeah.
And you're able to reassure them?
Yes, to say that if they are concerned about their well-being, if they are concerned about baby or any issues with them, then to come into triage or delivery suite to be assessed.
And as if on cue, baby Isla Jones with her parents Callum and Cassie.
What were your concerns? What were you thinking about when you were thinking about coronavirus?
I thought about it more prior to coming into the hospital. It was more of just passing anything on to the baby than anything, and thankfully we're both okay, so it all went well.
And did you come for all your antenatal checkups into the hospital?
Yeah. Just took extra precaution.
What did you do?
Well, sometimes Cal didn't come with me on some of them because he weren't allowed in the room anyway. And it's just making sure you're just keeping your distance.
When you try your best but you don't succeed, when you get what you want but not what you need.
Tonight the staff wanted to celebrate life, and specifically those patients who have recovered from the virus.
I will try to fix you.
Victoria MacDonald neatly enabling us to look in more detail at the guidance from NHS England suggesting that health workers from Black, Asian and minority ethnic backgrounds should be risk assessed over concerns they could be at greater risk, and they could be moved back from frontline services to reduce their infection risk, as UK-wide data suggests workers from minority backgrounds are, quote, disproportionately affected by COVID-19. Our Home Affairs correspondent Darshna Soni is in Birmingham. Darshna.
Today we've seen the details behind that guidance, John, and it makes for startling reading. We've learned that the whole programme in assessing the risk to BAME staff is being overseen by the NHS's CEO, Sir Simon Stevens. That gives you an idea of just how seriously this is being taken. And in the document, we get some details of just how much pressure Black and minority ethnic staff have been under. For example, they've been reporting worrying levels of anxiety and distress following the deaths of their colleagues. We've also learned that Black and minority ethnic nurses and doctors are having greater difficulty accessing PPE than their white colleagues. This is obviously very worrying, and hospital trusts are being told to consult with local trade unions and others to make sure that those staff feel confident in speaking up. Now, I've been speaking to a number of doctors today and they say they welcome these guidelines, but one consultant did point out to me that if the NHS does have to shield its frontline workers from roles as a precautionary measure, then the whole NHS will be under huge pressure because, remember, 44% of doctors and 22% of nurses are from a Black and minority ethnic background.
Darshna, could this potentially affect other sectors?
That's right. There are other areas that might be affected by this, John. For example, what about bus drivers, public transport workers, and the big issue, of course, nursing care staff in care homes. We know that there is a crisis in care homes, that we have seen thousands of deaths. I spoke to one care home manager today and she told me that around 70% of her nursing staff are from a BAME background. Now, we've heard more details today about just how these homes have been affected. We've learned that in the last week in England, there have been outbreaks in 458 homes. That's a huge number. And despite the government's announcement this week that staff and residents can now be tested for COVID, whether or not they display symptoms, there's still a huge amount of anxiety in care homes. We've spent the day speaking to one lady whose husband died in a nursing home last week. This is her story. 82 years young, Charlie Beattie loved to dance.
He was a gentle, funny man with a very, very dry sense of humour, but he could be extremely daft as well.
Jean and Charlie had been married for 61 years. That's a long time. What was your secret?
Probably the secret was that we both shared a cup half full mentality, and you just got on with things. We were born before the war and we learnt to make do, mend.
For the last 2 years, Mr. Beattie had been living in a specialist nursing home after being diagnosed with dementia. It was a happy 2 years, says Mrs. Beattie. Her husband was well cared for. But 2 weeks ago, he started showing signs of COVID. At the time, tests weren't available in care homes. It was only when Mr. Beattie was taken to hospital after a fall that he was tested.
And that, was when he was actually formally diagnosed with COVID. But, it was patently obvious from all the symptoms and everything, and the fact that several of them in there were showing the same symptoms. In a place like that where people are already compromised, their health is compromised, it's going to go through like a dose of salts once you get it in there.
In fact, 9 other residents have died at the home with suspected COVID. Only 2, including Mr. Beattie, were tested. Staff have also been infected. The manager says although they're lucky and have enough PPE, this has caused a huge amount of anxiety. 65 out of 123 staff members have been off sick, many with stress.
We've got staff off, and some of those off with stress because they're so scared, understandably, about this virus. It's not just the virus itself, it's got collateral damage as well. People are getting very, very frightened, understandably.
Mr. Bradley himself has had coronavirus, only recently returning to work. He welcomes the government's announcement this week that his residents and staff can now be tested.
But for a while, did it feel as if you were abandoned?
I think, quite honestly, I've managed nurse home for 25 years. We're used to it. We know we're the second cousin.
After a week in hospital, Mr. Beattie was discharged back to the home.
When he came back, it was patently obvious that he wasn't going to survive, and he died that night. But even then, it was good because we were able to be with him when he died.
Mrs. Beattie has nothing but praise for the care home workers who nursed her husband.
The one thing that I hope comes out of this COVID thing is that people recognise the sterling work that carers do in the community. We wouldn't survive without them, we really wouldn't. People who make comments about the fact that, they only, wipe their bums and do things like this. It's not like that at all. On the night that Charlie died, 2 of them came back at midnight and laid him out in their own time.
A generation who strove to make do and mend, who in their twilight years have felt abandoned in homes across the country.
I console myself with the fact that he was on an end-of-life journey. We're very lucky to have had him with us as long as we did, and I'd give anything to have him back with me now.
Well, earlier I spoke to Elizabeth Diacon, who is 97 and lives in a Wiltshire care home. She was one of the women who worked at the code-breaking headquarters Bletchley Park during the Second World War. So I began by asking her if she was more afraid living then in a sensitive place like Bletchley in war, or living now under the threat of the coronavirus.
No, because I think I was very young, and you were living for the day. I was afraid of bombs, but when you're actually living through it at that age, you don't think too much about it.
Are you thinking about the virus now and living through it?
Well, yes, because we're in lockdown and because we're not allowed any visitors. But I'm very lucky. I'm in a happy home, and I've got my radio, I've got talking books, and I've got my telephone, and lots of friends who ring me up.
Has anybody had the virus in the home, or have you been mercifully free of it?
No, we haven't, luckily. But a lot of homes have been badly affected.
What's it like actually living normally in a care home such as the one you're in?
But I must say I was rather afraid when I had to come in, but it's such a happy place. It's like living with a big family. I miss going out and doing things, but at my age, I'm quite content, really. I find it's going on a bit of a long time.
I noticed that you had been quite critical of the extent to which the government had made preparations for a pandemic. I mean, you were worried about some of the arrangements. Is that right?
Well, I thought they were a bit slow off the mark and slow in getting PPE out to care homes. But I live for the day. I don't worry too much.
Do you have any advice for the Prime Minister, for the government, for the people talking about care homes and their sort of relationship to the NHS?
Well, I think they left it a bit late, but the last week they've been coming up to date with the care home situation, and things are improving. But a couple of weeks ago, the carers here were called unskilled workers, but they've been renamed as key workers. But I don't think they get any more money for that, and I think they need more pay. And they wouldn't do this job unless they loved it. They could earn a lot more money in the supermarket.
Elizabeth, thank you very, very much for talking to us and for coming out into what I think must be a cold spring day. Thank you very, very much.
Thank you for asking me.